What follows is not a single account. It is many accounts, stitched together the way you stitch a wound, carefully, with attention to where each piece meets the next, trying to make the join invisible so the whole thing holds. I was not present for the initial incident. I arrived on Deck 9 approximately 40 minutes after the human, whose name is recorded in full as Corporal Davin Reyes, Coalition Armed Forces, 14th Forward Logistics Battalion, was brought in. By the time I reached the ward, most of the medical staff had already stopped pretending to work. They were watching him, just watching. I have compiled this document from 14 separate testimonies, 3 sets of clinical notes, 2 security recordings, audio only. The visual feeds on Deck 9 were down for scheduled maintenance, a fact that haunts me, and 1 personal letter that Corporal Reyes himself agreed to have included, after considerable persuasion, and what I understand was at least 1 frustrated argument with his commanding officer. I want to be honest about why I made this document. It isn't purely scientific. Something happened on Deck 9 that the people who were there cannot stop talking about. It comes up in hallway conversations, in mess hall debates, in the quiet moments before a difficult surgery when someone needs to remember that living things are more resilient than we think. It has become a kind of story, the kind that gets passed between people who need it. I thought it deserved to be written down properly, before the details got lost, before the human in it became a symbol instead of a person. He is a person. That matters. Please remember that as you read. Recorded interview, Cycle 7, Month 3, SY 2887.4. Duration, 47 minutes. Transcribed and lightly edited for clarity. I want to start by saying I am good at my job. I say that not to brag. I say it because what I'm about to tell you happened to someone who is good at their job, who has been doing triage for 11 years, who has seen things that would make most civilians shut their eyes and look away. I need you to understand that context, because otherwise you'll hear what I'm about to say and think I'm being dramatic, and I am not being dramatic. I have never been less dramatic in my life than I am right now. The call came in at approximately 3:40 station time. Shuttle Bay reported an incoming emergency transport, a coalition military vessel, Registry CF Anvil 9, requesting immediate Trauma Bay access. The manifest they transmitted said 4 casualties, 2 Voraki soldiers, 1 Prothean communications officer, and 1 human. I noted the human. We don't get many humans out here on the outer rim. The station sees mostly Voraki, Prothean, Chelik, and the occasional Dasari trade crew. Humans come through maybe once every 2 or 3 months, usually merchant marine types or the odd academic. Military humans are rarer still. I pulled the standard Class 4 Deathworlder protocol brief while the transport was docking. It's only 4 pages, but we're supposed to review it whenever a high-classification biological is incoming. The brief lists things like atmospheric requirements, standard oxygen-nitrogen mix, which we maintain anyway, temperature tolerance range, which is broader than most species, and the standard warning about human physiological responses being counterintuitive. That last part is the one everyone skips when they're in a hurry. The brief literally says, in bold type, human injury presentation is frequently misleading. Humans may appear calm or functional while sustaining injuries that would incapacitate most galactic species. Do not use behavior as a proxy for severity. I had read that brief before, multiple times. I thought I understood it. I did not understand it. The transport docked at 3:47. The bay doors opened, and the first 2 casualties came through on anti-grav stretchers, the Voraki soldiers. They were in bad shape. One had a compound fracture of the primary weight-bearing limb, the bone visibly displaced, and was producing the low subsonic distress hum that Voraki make when they're in serious pain. The other had blast burns across roughly 30% of their outer carapace. Both of them were being actively treated by the transport's medic, A Prothean, young, looked exhausted, hands shaking slightly. Behind them came the Prothean communications officer, walking but supported by a crew member. She had a head wound that had bled significantly. Prothean blood is pale green, almost iridescent, and there was a lot of it in her neck feathers. She was pressing a field dressing to the wound, and her second set of eyes, the inner pair they use for close focus, was clouded over, which usually indicates concussion in Protheans. And then there was the human. He walked off the transport on his own feet. I noticed him immediately, not because of anything dramatic. He was just there, upright, moving under his own power. He was wearing the remnants of coalition combat gear, the kind of modular armor plating that attaches over a standard pressure suit. A lot of it was missing. What was still attached was damaged. One of the shoulder plates was cracked almost completely through, and the torso section had a deep gouge across the front that went through both the outer plate and the inner padding. I thought, okay, walking casualty, possible shock, let's see what we're dealing with. He came through the bay doors and he looked around the triage bay with this expression that I've been trying to describe to people ever since, and I keep landing on the same word: assessment. He wasn't scared. He wasn't dazed. He was looking at the room the way you look at a room when you're trying to figure out where you need to be and what you need to do. Then he walked toward me. He stopped about 2 meters away and said, in clear, accented galactic common, "Excuse me. My crew is in worse shape than I am. Can you make sure they're triaged first?" And I said yes, because that was the correct answer medically. The Voraki with the bone fracture needed immediate attention, and I directed him to a waiting area, and I went back to coordinating the incoming cases. It wasn't until I finished the initial triage protocol and turned back to check on him that I actually looked at him. I mean really looked. The way you look at a patient rather than a person walking around. He was sitting in the waiting area. He had removed part of his torso armor, the section that had been gouged, and he was prodding at his own ribcage with his fingers, and his face was doing something complicated. Not crying, not grimacing exactly, something more contained than that. He'd press 2 fingers against a spot, pause, press somewhere else, pause again. Systematic, like he was running a self-diagnostic. I went over. I said, "Sir, can I get your name and unit?" He looked up. He said, "Rays, Corporal Davin Rays, 14th Forward Logistics, attached to the Anvil 9 on a medical transport escort." Then he said, "I think I've got at least 2 ribs compromised, maybe 3, left side. And there's something wrong with my left shoulder. The joint isn't tracking right. Probably the AC joint." I pulled out a scanner. I said, "What happened?" He said very flatly, "Ambush at the Hero Corridor checkpoint. We were moving the Prothean unit through. They're a diplomatic party, not military, and we got hit by a separatist cell. 4 attackers. They're not going to be a problem anymore." I noted the phrasing. I started scanning. The scanner results came back in about 12 seconds. I looked at the results. I looked at him. I looked at the results again. He said calmly, "What's the damage?" And I said, because I genuinely could not help myself, "How are you sitting upright?" Testimony 2, Medical Scanner Operator Tev Drallo, Triage Deck 9. Written statement submitted Cycle 7, Month 3, unedited. I was the one who ran the full-body imaging on the human when Nurse Krell flagged him for priority assessment. I want to be precise here, because I know this document is going into the medical archive, and I want the details correct. The patient, Corporal Rays, was cooperative throughout the imaging process. He sat in the scanner housing without difficulty, although I noted afterward that the way he moved getting into position was careful, not pained exactly, deliberate, like someone who knows which parts of themselves not to jostle. The imaging took approximately 4 minutes for a complete skeletal and soft tissue survey. I processed the results in real time and flagged them to Dr. Fiva Ulara, our chief of trauma, within 30 seconds of completion. Here is what the imaging showed, in the order I flagged it. Skeletal findings. Left ribs 4, 5, and 6, full fractures displaced. Rib 7, hairline fracture not displaced. When I transmitted these results to Dr. Ulara, her first response was to ask if I had perhaps imaged the wrong patient. I confirmed I had imaged the correct patient. There was a pause. She said, "Is he conscious?" I said, "Yes, ma'am. He's asking Nurse Krell if there's anywhere he can get water." Another pause. She said, "I'll be down in 4 minutes." Testimony 3, Dr. Fiva Ulara, Chief of Trauma Medicine, Heroic Station. Audio log, Personal Cycle 7, Month 3, transcribed with permission. I need to just let me get this organized. I've been in trauma medicine for 23 years. I trained at the Voracki Institute on Heroic Prime before it was relocated after the corridor disputes, and I've done 4 tours as a field trauma consultant with the Coalition Medical Corps. I have seen combat injuries. I have triaged mass casualties. I am not someone who gets rattled. So when I say that what I found when I got to Deck 9 at approximately 4:12 station time made me stop in the doorway with my tablet in my hand and just stand there for a moment, I want that on record as a clinical observation, not an emotional one. It was information. The information surprised me. Corporal Reyes was sitting in the secondary triage bay, which is where Nurse Krell had moved him after the scanner results came back. He had a cup of water, someone had found him water, and he was drinking it slowly, in that way people drink when they're thirsty but they're also watching the room. Alert. He'd taken off more of his armor. He was wearing the underlayer, a thermal weave bodysuit, and the damage to it was visible. Tears, burn marks, dark staining that was blood his, and from the color and volume he'd lost a meaningful amount. His left arm was held slightly away from his body, not dramatically, just enough, the way you hold a limb that you've stopped trusting to work normally. I walked over. I introduced myself. I told him I'd reviewed his imaging and I needed to ask him some questions. He said, "How are my people doing?" I told him the Voracki soldier with the bone fracture was in surgery, good prognosis. The second Voracki was receiving burn treatment. The Prothean communications officer had a concussion and a scalp laceration but was stable. He relaxed slightly when I said that, not a lot. Just a small decrease in the tension he was carrying. I noticed it because I was watching carefully by that point. Then I said, "Corporal, I need to ask you some questions about your own condition." He said, "Of course." I said, "The imaging shows fractures in your left ribs, your clavicle, and what appears to be a stress fracture in your right forearm. It also shows damage to your acromioclavicular joint, compression in 2 of your cervical vertebrae, a small bleed in your left pleural space, and lacerations to your liver and spleen." He nodded, like I just read him a weather report. I said, "You walked off the transport?" He said, "Yes." I said, "You walked off the transport, crossed the bay, spoke coherently to my nurse, and have been sitting here, drinking water for the last 15 minutes. He said, "Yes." "Is that unusual?" I said, and I want this in the record. "Corporal, a Voracki with a grade IV AC separation cannot lift their primary grasping limb. A Prothean with the quantity of pleural bleeding you have showing would be in respiratory distress. A Chelik with the vertebral compression you have showing would require emergency spinal support. You are sitting here drinking water." He considered that for a moment. He looked at his water cup. He said, "I've had worse." And the really alarming part, I believed him. Interview transcript, Cycle 7, Month 4. Duration, 31 minutes. Fiva called me in at about 4:30. I was off rotation, but she said, and I remember her exact words, "Ravin, come down to 9. I need a second set of eyes on something that is either a miracle or a misunderstanding, and I can't tell which. I came down. The human, Corporal Reyes, was by then moved to an actual treatment bay. He was lying on the surface, lying, not sitting, which represented some progress toward appropriate patient behavior, and he had agreed to an IV line, which Nurse Krell told me later he had negotiated. He had said he didn't want anything that would make him fuzzy, which is the word she used, and they had reached an agreement. Fluids, electrolytes, and a low-level analgesic that Fiva told me represented approximately 8% of the standard dosage. She would have given a Prothean patient of equivalent mass. 8%. I stood over him and I looked at the imaging results Fiva had sent to my tablet, and I said, "Corporal, I'm Dr. Chelik. I'm going to examine your left shoulder if that's all right." He said, "Go ahead." I palpated the joint. He made, and this is the part that gets me, he made no sound. A grade IV AC separation is categorized in our training materials as producing severe, debilitating pain in all species so far cataloged that have been evaluated. We have a standardized pain protocol for it. It involves significant pharmacological intervention before we even attempt to assess range of motion. I said, "Does this hurt?" He said, "Yes." I said, "On a scale of 1 to 10, and then I stopped because I realized I didn't know what his scale was. I said, "Actually, can you describe it?" He thought about it. He said, "About a 7, maybe a 7.5. It's a sharp pain with movement, dull ache at rest. It's limiting but manageable." A 7. I have a Voraki colleague who went home for 3 weeks after a grade II AC separation. Grade II is less severe than grade IV by 2 full classification levels. I said, "Can I ask you something personal?" He said, "You can ask." I said, "How do you manage this, functionally? Because what I'm looking at does not match how you're behaving, and I've been in orthopedic trauma for 18 years. He was quiet for a moment. Then he said, "I'm not sure I have a good answer for you, doctor. This is just what my body does. It keeps going. It's always done that." He paused. Then he said, "My mom used to say that humans are too dumb to know when to quit. I think she meant it as a compliment." I laughed. I couldn't help it. And then I went back to looking at his imaging results, and I thought, she wasn't wrong. Testimony 5, Nurse Krell continued. Additional interview notes, Cycle 7, Month 4. Okay, so there was the shoulder thing, and the ribs thing, and the spinal thing, and all of that is documented. But the thing that I keep coming back to, the thing that nobody else has written down yet, is the conversation about the pain medication. When Dr. Ulara first discussed pharmaceutical management with him, she offered him a standard Deathworlder protocol dosage, which we calculate at 40% of the species weight-adjusted equivalent. He declined. He said, and I wrote it down because I knew someone was going to ask about it eventually, "I've had a bad reaction to analgesics before. They tend to knock me down harder than expected. I'd rather stay clear and just manage." Dr. Ulara said, "Corporal, you have multiple fractures and internal bleeding. You need pain management." He said, "I've got 3 busted ribs. I know what broken ribs feel like. They're not comfortable, but they're not killing me. The shoulder's worse, but I can't feel my spleen hurting, so that's the one that worries me more. Can we focus on managing that?" Dr. Ulara stared at him. He said, "I can handle the pain. I just need to know what I'm dealing with inside." She said, and I wrote this down too, "You cannot handle a grade IV acromioclavicular separation without medication, Corporal. It is not physiologically plausible." He said, very gently, not arguing, not dismissive, "I think we might have different definitions of handle." She ended up giving him 20% of the standard dose, a compromise. And he spent the next 4 hours in that treatment bay, mostly resting, occasionally asking questions about his crew, and one time I watched this happen. He sat up, slowly and carefully, and did a series of breathing exercises. Deep, controlled, with this absolute stillness to his face that made him look like he was somewhere else entirely. I asked him what he was doing. He said managing. Testimony 6, Dr. Deathworlder continued. Clinical Notes Excerpt, Cycle 7, Month 3, formatted for archive inclusion. 6:15 hours. Reassessed corporal rays following 4-hour monitoring period. The hemothorax has not expanded, stable at approximately 200 ml, well below threshold requiring drainage intervention. The liver laceration, per repeat imaging, shows early signs of what I can only describe as aggressive endogenous repair. The imaging shows fresh fibrin deposition at the wound margins that would normally indicate a 24 to 48-hour recovery window is progressing approximately double the expected speed. I asked him if he'd had any augmentations, subdermal or genetic. Coalition military humans sometimes receive enhanced healing factors as part of combat preparation protocols. He said, "No, I'm standard issue." I said, "Corporal, your liver laceration is healing faster than I would expect." He shrugged, then winced. I noted the wince. He'd forgotten the shoulder for a moment. He said, "We heal fast. It's a human thing." I said, "How fast?" He said, "The ribs will probably be okay in." And then he stopped and said, "Actually, I don't know your timeline units. In my reckoning, maybe 4 to 6 weeks. The shoulder will take longer, 3 months, maybe more. I've never had an AC joint this bad." I said very carefully, "You've had this kind of injury before?" He said, "Not the shoulder, no. Ribs, yeah, broken ribs I've had before, broken arm once, concussion twice. This is actually," he seemed to be doing a genuine accounting in his head, "this is probably top 3 damage-wise." I said, "What were the other 2? He said, "An IED hit on the Fenris moon." And he paused, and something moved across his face that wasn't pain exactly. "There was a thing on Hero Corridor about 2 years ago. Different situation. I don't really like talking about that one." I did not push, but I noted it. 7:30 hours. Consulted with Dr. Chelik about orthopedic management plan. The clavicle fracture and AC separation will require either surgical fixation or extended immobilization. Given the human's expressed preference for minimal pharmacological intervention, we have agreed to discuss both options thoroughly with the patient. Dr. Chelik's assessment. He's going to want to be up and moving too fast. We need to set clear expectations. My assessment. I suspect clear expectations will have a complicated relationship with what he actually does. This section documents the event that has most widely circulated among Hero Station staff. I want to note, before presenting the testimonies, that there is some variation in the accounts, not because anyone is being dishonest, but because people experienced it from different positions and angles, and human memory has a way of sharpening the parts that mattered to you personally and softening the parts that didn't. I have presented the accounts in the order that best reconstructs the sequence of events. Testimony 7, Orderly Massotelm, Deck 9 Recovery Ward. Written Statement, Cycle 7, Month 3, unedited. I was assigned to general ward duties that morning, which meant checking in on patients in the secondary recovery section. Corporal Reyes had been moved there from the treatment bay at about 800, after Dr. Ulara was satisfied that the hemothorax wasn't expanding. He had a private room because we try to give Deathworlder patients extra space. It's in the protocol, but the door was open. I checked in on him every hour as per instructions. At 800 he was awake and had asked for something to read. At 900 he was asleep. At 1000 he was awake again and asked me how the Voraki soldier, he kept referring to her as Yarrow, how Yarrow was doing. I told him she was out of surgery. He said thank you twice. At approximately 11:15, I was in the hallway about 2 rooms down when I heard something from the direction of the Prithian communications officer's room. A raised voice speaking Prothean, which I don't understand well but can tell when it's distressed. And then a different sound, something being knocked over. I went toward the sound. The Prothean communications officer, diplomatic attaché Saravine, her name, was in her room, and there were two people I didn't recognize standing near her bed. They were in civilian clothing, but there was something about the way they were standing that wasn't right. I don't know how to explain it better than that. Something about where their feet were, how they were holding their hands. Attaché Saravine was pressed against the head of her bed, her inner eyes closed, her crest feathers raised, which is what Protheans do when they're frightened. The item that had been knocked over was her medical monitoring device. I said I know it was not the right thing to do, but I said, "Hey, can I help you?" The way you say it when you don't mean "can I help you," but you mean "please leave." One of the visitors turned to look at me. The other one didn't. That one kept watching Saravine. And then someone pushed past me from behind and went into the room. Testimony 8 Attaché Saravine, Prothean Diplomatic Corps. Translated from Prothean. Statement recorded Cycle 7, Month 4 during formal inquiry. Edited for length. I had been awake for perhaps an hour. My head was painful, the concussion, the doctor said. I had a bandage on my neck. I was thinking about the ambush. I was thinking about what I had been carrying. The diplomatic material I was transporting between the outer hero posts, sensitive materials, relating to the corridor negotiations. I had transmitted the primary documents before the attack, but the secondary package, the physical data cores, had been in my case. I did not know yet whether my case had survived. The two people came in without announcing themselves. They were in station civilian clothing, but they moved wrong. I have spent 19 years in diplomatic service. I know how a person looks when they have been trained to move efficiently. These people had been trained. The one who spoke said that they were security consultants. They said they needed to verify that the materials in my possession were intact and accounted for. They said this in a way that was professional, but that did not feel like security. It felt like the words you say when you want to seem like you're the authority, but you're hoping no one checks. I said I wanted to call my embassy contact before I spoke with anyone about my materials. The one who spoke said there wasn't time for that. The other one stepped closer to my bed. He didn't say anything. He didn't need to. I said I wanted a medical staff member present. The one who spoke said that wasn't necessary. And then the orderly appeared in the doorway and said something, and the visitors looked at him. And then there was movement in the hallway and someone came through the door. I recognized him immediately. It was Corporal Reyes. He was wearing a patient gown. He was barefoot. He had no armor, no weapon that I could see. His left arm was held close to his body, the shoulder, I knew from earlier when he had visited me to check on my condition. He was standing straight. His face was entirely calm. He looked at the two visitors the way you look at a calculation you already know the answer to. He said, in Galactic Common, very quietly, "I think the attaché said she wanted her embassy contact before any conversations happened." The one who spoke said, "This isn't your concern, soldier." Corporal Reyes said, "Sure it is. She's my passenger." Testimony 9, Security Officer Pren Vasic, Hero Station, Internal Security Division. Formal Incident Report Excerpt, Cycle 7, Month 3. We received an alert from Deck 9 nursing staff at 11:19 station time and dispatched a two-person unit. Upon arrival at approximately 11:22, we found the following situation in progress. In the room of diplomatic attaché Saravine, two unidentified individuals in civilian clothing, the attaché in a distressed state, orderly Masso Teln in the doorway, and Coalition Corporal Davin Reyes, a patient currently admitted with significant injuries, standing between the attaché's bed and the two individuals. Corporal Reyes was not wearing armor or carrying any visible weapon. He had a patient identification band on his right wrist and what appeared to be an IV line that had been disconnected. The end was dangling from his right arm, suggesting he had removed it himself. He was barefoot on the medical ward floor. The two unidentified individuals were later identified as personnel attached to a separatist intelligence network known to have been monitoring the Prithian diplomatic convoy. Their presence on the station is the subject of a separate security investigation. What I observed when I arrived. Corporal Reyes was speaking calmly to the two individuals. He was not shouting. He was not making threatening gestures. He was standing with his right side slightly forward. I noted later that this was likely because his left shoulder was damaged, an adaptation to keep his functional arm available. One of the individuals made a movement that I would characterize as aggressive, a step toward the corporal with a posture shift, suggesting intent to escalate physically. What happened next took approximately 2 seconds. I will write what I observed, and I want to note that I reviewed the account with my partner, Officer Drenna Saul, and she confirms this sequence of events. Corporal Reyes shifted his weight. He used his right arm. The individual who had stepped toward him was then on the floor. The corporal had not appeared to move quickly, or not quickly in any dramatic way. There was no shout, no running start. But the outcome was that the individual was horizontal and the corporal was still standing, in more or less the same position, and the second individual had taken a step backward. Corporal Reyes said, still quietly, "I've had a long night. I'd recommend making different choices." The second individual did not make different choices immediately, and there was a short further exchange. I will not characterize the biomechanics of it because I am not a combat analyst, and then both individuals were subdued. My partner and I restrained and removed them at that point. I spoke with Corporal Reyes as we processed the scene. He was leaning against the wall. He was breathing carefully, which I noticed because it was deliberate, the kind of breathing that is work. His left arm was back at his side, and his face had that contained expression that several of my medical colleagues have described. I said, "Corporal, you should go back to your room." He said, "Yeah." I said, "You have broken ribs." He said, "Yeah, I know." He looked at Attaché Saravine. He said, "You okay?" She said in Prithian accented common, "I am." Then she said, "Thank you." He said, "You're my passenger." He said it simply, like it was an axiom, an obvious truth. Then he walked back down the hall to his room, bare feet on the medical ward floor, one arm held close to his body, breathing carefully, and he closed the door. Testimony 10, Dr. Fivolara continued. Audio log, personal, cycle 7, month 3, transcribed with permission. I found out about the incident from Nurse Krell at approximately 11:30. She came to my office and said, "Your Deathworlder patient just physically subdued 2 intelligence operatives with 3 broken ribs and a dislocated shoulder, and now he's back in his room asking if someone can reconnect his IV." I went to his room. He was in bed. Sitting up, I noted the angle. He'd arranged the bed to take weight off his lower back, which was where most of the muscular bruising was concentrated. His right arm was extended toward Nurse Krell, who was reconnecting the IV line. His face was the most tired I'd seen it. I said, "Corporal." He looked at me. I said, "You have a hemothorax." He said, "I know." I said, "And a grade IV AC separation." He said, "I know." I said, "And you just..." He said, "I know what I just did. I also know Saravine's carrying corridor negotiation materials, which means those people weren't just trying to rob her. They were trying to pull critical diplomatic data from a woman with a concussion who was alone." He met my eyes. "What would you have done?" I didn't answer that. He said, "I didn't use the shoulder. I was careful." I said, "You pulled your IV out." He said, "I was in a hurry." I said, "Did anything tear? Internally, do you feel any change in your breathing?" He paused, listening to himself, the way I'd started to notice he did, checking his own systems like a pilot checking instruments. He said, breathing's the same. Maybe one of the ribs shifted. It hurts different, the four, I think, but my lung sounds clear to me. I stood there for a long moment, then I pulled up my scanner. Nothing new. The rib 4 fracture had, as he suspected, shifted slightly. The hemothorax had not changed. The liver laceration was, absurdly, still in the process of healing faster than expected. I said, "You need to stay in this bed." He said, "Yes, doctor." I said, "I mean it." He said, "I know you mean it." Then he said, "Can someone check on Saravine?" I said, "I'll check on her myself." He said, "Thank you." I walked out of his room and I leaned against the wall in the hallway for about 30 seconds. Not because I was upset or angry or even, exactly, surprised. Just because sometimes you need a moment when something has no available category in your experience, and you need to file it somewhere, and you haven't figured out where yet. Part 4. The Witnesses. These testimonies were collected in the weeks following the incident from Hero Station staff, who came into contact with Corporal Reyes during his recovery. They are included here for the sake of completeness, and for what they reveal about the secondary effects of the incident on the station community. Testimony 11, Yarrow Voraki Soldier, full name withheld by request. Written statement translated from Voraki Standard. Submitted Cycle 7, Month 4. I have served with a dozen species. I have fought alongside Chelik assault units and Prithian sniper teams, and once, on Terra of 7, a Dasari demolition specialist who I still do not fully understand, but who I trust with my life. I have never served alongside a human before Reyes. After my surgery, I asked to be moved to a room near his. This was approved. We spoke through the door mostly because I was still receiving treatment and not supposed to leave my bed either. He would ask about my leg. I would ask about his shoulder. We had what I would call a competition of minimization. We were both trying to convince the other that our injuries were not significant. It was, in retrospect, a very stupid competition, since we both had the medical imaging to prove otherwise. On the second day, he told me what happened in the Prithian's room. I said, "With the shoulder." He said, "I didn't use the shoulder." I said, "With 3 broken ribs." He said, "Cracked, technically cracked. The first one might be all the way through, but..." I said, "Reyes." He said, "Yarrow." I said, "You are insane." He said, and I want to get this right because I've thought about it many times. Someone had to. I was the one who could. That's just math. I am Voraki. My people have a saying that translates roughly as, "The one who carries the weight is not the strongest. They are simply the one who did not put it down." I had never thought of this saying as applying to beings outside my species until that conversation. I stand corrected. Testimony 12, Receptionist Dovacelum, Hero Station Administrative Desk, Deck 12. Informal recollection, recorded Cycle 7, Month 4. I don't have a clinical observation to offer or anything like that. I just worked the desk on Deck 12, and he walked past me a lot when he started being allowed to walk. By day 3, he was walking the corridor. With permission, he showed me the authorization slip. He was very particular about having the authorization slip, and he would go down to the observation window at the far end of the deck because you can see the corridor from there, the actual Hero corridor, the passage between the 2 asteroid bodies. He would stand there for a while and look at it. Once I asked him what he was looking at. He said, "Just the view." I said, "Is it a good view?" He said, "It's the view that's there." I didn't really understand that at the time. I think I understand it better now. He'd been ambushed in that corridor. Something about needing to look at it and have it just be a place again instead of the place where the thing happened. I don't know if that's what he meant, but it's what I think he meant. He was always polite, Every single time he passed the desk, he said good morning or good afternoon or good evening, depending on the station clock. Not a nod, not a wave, he'd actually stop and say the words. I don't know why that stuck with me. It's such a small thing. But it felt like something that had been decided, somewhere a long time ago, that he was going to do that, and no amount of broken ribs was going to stop him. Testimony 13. Attaché Saravine continued. Personal letter, submitted for archive inclusion with permission, translated from Prathian. I wrote this letter to Corporal Reyes directly, and I give permission for it to be included in the archive document, because I think the record should have his perspective included, and his own statement is very brief. So perhaps mine can be a window into what I observed of him that is not clinical. Dear Corporal Reyes, I have been trying, since leaving Heroic Station, to write a letter that adequately expresses what I want to say. My colleagues in the diplomatic corps tell me that I am usually very good with words, but I find that I keep getting stuck. Let me try to be direct instead. I watched you walk into my room. I watched you interpose yourself between me and people who frightened me, with injuries that a Prathian physician I consulted later told me would have required surgical stabilization before any physical activity in a patient of equivalent mass from most species. I watched you do what you did, efficiently, and without apparent hesitation, and without any of the heightened energy that usually accompanies violent physical confrontation. You were simply present, and then the problem was resolved, and then you asked me if I was all right. I think about this often. I want to be honest. I asked Dr. Ulara afterward how you were doing. I wanted to know if I had cost you something, if what you did had set your recovery back. She told me, with what I think was carefully professional language, that your body continued to be stubbornly unimpressed by its own damage. I found that reassuring, but also, and I want to say this carefully, I found it a little sad. Not because of anything you did wrong, because of what it implies, that you have been in enough situations that required that kind of endurance, physical, psychological, that your body has become practiced at it, that you have learned to function through things that should stop you because, in your life, stopping has often not been an option. I do not know if you would characterize your own experience this way. Perhaps I am projecting, but I have spent 20 years watching human diplomatic staff alongside galactic representatives, and I have come to believe that there is something about your species' relationship with damage that the rest of the galactic community does not fully understand. Not invulnerability. The opposite, actually. You are vulnerable, you bleed, you break. You feel pain, you die. But you have developed a relationship with your own vulnerability that allows you to keep going through it in ways that seem, to other species, to be physiologically impossible. I don't think it's physiological. I think it's a decision, or something that operates like a decision. Something that gets made, perhaps below the level of deliberate thought, about whether to stop or whether to continue. And I think most species, when that question is asked at extreme enough thresholds of damage, have a neurological and physiological architecture that says, stop, rest, wait. And I think your species, for reasons that are probably not entirely comfortable to contemplate, often answers differently. You said, when you came to check whether I was well, that I was your passenger, that made it your concern. I have thought about those words many times. I was not your first priority. I am a Prathian diplomat. You are a coalition logistics escort. In any formal chain of accountability, your responsibility to me was professional but not personal. You had been awake for over 20 hours. You had injuries that should have kept you in bed. No one would have criticized you for staying in your room. And yet, I do not have the words in Prathian or in common for what I want to say, so I will just say, thank you, for walking through that door, for standing there, for asking me afterward if I was all right, as though the question you needed answered most urgently was mine. I was all right because of you. Saravine, Diplomatic Attaché, Prothean Foreign Ministry. Written by hand. Submitted directly to Archivist Vorn on the morning of his discharge, day 9 of admission. Unedited. The archivist asked me to write something for this document, and I said I wasn't sure what I'd have to add since everyone else seems to have covered it. She said I was the only one who hadn't been asked, and that the record should have my voice in it. So here. I'm not a good writer. My sister is a good writer. I am the kind of writer who writes things down mostly so I don't forget them, not because I think anyone else would want to read them. But I'll try. I grew up in a place called El Pinar. It's a small city in the mountains, real mountains, not the kind of geological formations that most spacefaring species mean when they translate the word. Cold in winter, green in summer, the kind of place where your neighbors know your name and you know their dog's name, and everyone has an opinion about what time of year the weather turns. My grandmother lived at the top of a very steep hill. I used to walk up it with her when I was small and later when I was bigger and she was older and the hill never got shorter. It was always that same climb. She would tell me halfway up that the hill was not her enemy. She'd say, "The hill is the hill. You know the hill is there. You make your peace with the hill and then you climb it." I didn't understand that until I was much older. I don't know how to explain to people of other species what it is like to live in a human body. I don't mean that as an insult. I've learned, in my time in coalition service, that every species has its own embodied experience that is difficult to translate. But I'll try. A human body is not invincible. Anyone who thinks that about us is wrong, and I've had to have some version of that conversation with admirers who took the wrong lesson from whatever story they'd heard. We die, easily in cosmological terms. We bleed, we break, we get sick in ways that can end us in days. But there is something that happens, something I don't have a clinical word for, when a human body is in the middle of a situation. A kind of narrowing. Everything that isn't immediately necessary gets set aside. Pain gets set aside. Fear mostly. Fatigue to some extent. The thinking gets very clear and very simple. What do I need to do and how do I do it, and what are the obstacles between here and there? I don't know if that's a physical thing or a psychological thing, or something that's been trained into me by years in uniform. Probably some of all three. When I heard the sound from Saravine's room, I didn't make a decision to get up. I was up. The decision, if there was one, happened somewhere I don't have access to. And then I was in the hallway and I was walking toward the noise. The shoulder hurt. The ribs hurt. There was a deep pulling ache in my back that I'd been managing since about 200 of the previous day and hadn't fully assessed because there hadn't been time. I noticed all of it the way you notice traffic when you're driving. It's there, it's information, but it's not what you're looking at. I went into Saravine's room. I saw what was happening. I did what needed doing. That's the whole story from where I was standing. I know the medical staff have found it remarkable. I know Dr. Ulara has been citing my case in her teaching. I know because Saravine told me, and because she's a diplomat who chooses her words with the kind of care that implies she has strong feelings about things, that what I did meant something to her. I'm glad it meant something, but I want to be honest. I wasn't thinking about what it would mean. I was thinking about the two people who were in her room and the angles and the one functioning shoulder and how to solve the problem. The problem got solved. I'm glad the archivist is writing this down. Not for me, I don't really have a use for being documented. But because Dr. Ulara said something to me on my last check-in yesterday that I think is worth repeating. She said, "I want to understand your species better. I've been practicing medicine for 23 years and I don't think I had a framework for what humans actually are. Not really." I said, "What do you think we are?" She was quiet for a moment. Then she said, "I think you're beings who decided that damage is not the same as defeat. I think you made that decision so long ago that it's in the architecture now. and I think the rest of us are still catching up to what that means. I thought about that. I thought about my grandmother's hill. I said, that's about right. She discharged me this morning, right shoulder immobilized. Physical therapy protocol loaded onto my medical chip. Strict instructions not to engage any intelligence operatives for at least 8 weeks, which is a direct quote from Dr. Ulara's discharge notes, and yes, I did ask her to leave it in. The corridor looked the same from the observation window this morning as it always has, wide and dark and lit by the secondary star coming around the asteroid's arc, cold-looking out there, quiet. Just a place. My grandmother's hill was just a hill. Once you climbed it, it was behind you. You didn't forget it was steep, but it was behind you. That's how it goes. I met Corporal Reyes once briefly on the morning of his discharge. I gave him the copy of this document, what existed of it at that point, and asked him if he had anything to add. He read through it, standing in the hallway with his right arm in a sling and a duffel bag over his good shoulder. He read it carefully. He asked me to change one word in Dr. Chelik's testimony, which I did. He said the word Dr. Chelik used wasn't accurate to his experience. The word for the record was stoic, he said. I wasn't being stoic. Stoic means suppressing what you feel. I wasn't suppressing anything. I was just managing. It's different. I changed stoic to contained. He approved that version. He handed the document back and said, "It's a good record. Thank you for putting it together." I said, "Thank you for letting me." He shifted the duffel on his shoulder, the good one, and started toward the transport bay. He walked evenly, not quickly, not slowly. His back was straight. I watched him go until he turned the corner, and then I stood in the hallway for a moment, thinking about all the things the 14 people in this document had said, and what they added up to. I don't think they add up to something simple. He is not invincible. He never claimed to be. Dr. Ulara was very careful to note that in her clinical findings, within species-appropriate parameters, the human body remains mortal and vulnerable to catastrophic failure. The patient's presentation should not be taken as evidence of physiological invulnerability. But I keep coming back to something that is not in the clinical record, something that is, perhaps, not clinical at all. When Saravine described him walking into her room, barefoot, patient gown, disconnected IV line dangling from his arm, she said he didn't look frightening. She said he looked certain. That is the word I have been looking for, reading through all these testimonies, trying to find the thread that connects them. Not invincible, not reckless, not built differently from the rest of us in any way that the imaging could quantify. Certain. Certain that the problem in that room needed solving. Certain that he was the one who could solve it. Certain that damage, real, documented, significant damage, was not the same as incapacity, not the same as being finished, not the same as defeat. The rest of the galactic community looks at a human body bearing that kind of damage and sees a being who should not be functional. The human looks at a human body bearing that kind of damage and sees, apparently, something to be managed. An obstacle, not an endpoint. I don't know what to do with that, exactly. I suspect the galactic medical community is going to be working on it for a long time. But I will say this, for the record, as the person who compiled this document and who has read every testimony and every clinical note, and who spent 4 hours one afternoon just sitting with the scanner imaging from day one, looking at all those bright white fracture lines and that shadow of blood pooling in the pleural space, I would want him in my corner. Whatever was in that room with Saravine, whatever trouble it was, whatever threat it presented, it came up against something it did not have a category for, something that had learned, somewhere along the road of a life spent in difficult places, that the hill is just a hill, that damage is just information, that the question of whether to get up is not a physical question. It is, apparently, a human one. And apparently, Humans have been answering it the same way for a very long time.